My name is Sandra. I'm from Simi Valley, California. And I am the three-boobed lady. My breasts right now are a train wreck. My nipple is pointing to the right. My left breast is hard and tight.
Okay, I've been doing this for 12 years, and I've seen some pretty messed up stuff. I can't wait to see this. I already have tons of ideas in my brain about what I think's going on here, but let's get to it. This is truly botched.
Worst of all, I have a third breast in the middle of my chest. I got the end of the stick, I really did. At this point, I just want them to be where they're supposed to be. Would like to have just 2 breasts instead of 3.
I'm telling you guys, as much as everyone says, like, love who you are, be who you are, the fact of the matter is we all have insecurities. And so when you go to address something like this and then you end up botched like this, I can't even imagine the mental health toll that this takes on someone. So let's see what happens to her and let's see how she gets through this.
He loved to see me in sexy lingerie. He bought it for me all the time. So I wanted to fill it out. I was a size 32A. I had just little, small, perky boobies. So I decided that I was gonna get my breasts done. Going into my surgery, I was very excited. I woke up and I felt like somebody had run me over with a truck. I couldn't breathe. I couldn't catch my breath. I'll never forget that pain.
So the pain, let's talk about that. The most common complaint that we hear with these surgeries is it feels like there's an elephant sitting on your chest. And that's because we put the implants underneath the pectoralis major muscle. There's a lot of tension. The muscle is tight and under spasm. Most of the time, I just hear women say that they were really, really sore, like a bad chest workout, and that medications controlled it. And after 1 to 2 weeks, that just kind of subsides.
The breast on my right was just a little higher and very hard. So I went in for my second surgery.
So if you flip back after her first surgery, she had a breast lift at the same time, so implants on the lift. We normally make that incision and follow the breast crease so that that incision lands and stays in her breast crease. And if you notice on her picture, that incision before her second surgery was actually up above where the implant looked like it had settled below, which makes me suspicious that the surgeon violated the breast fold, which is a big no-no.
The swelling went down. I noticed the breast
worse.
started falling. My breast moves literally all over the place. It looks like a third boob. It's horrible.
Let's pause right there. I'm gonna tell you exactly what's happening. We're gonna put up a picture, a freeze frame of when she let that implant go and it was sitting towards the middle. Here's exactly what's happened. You can see the delineation of her actual breast tissue, which looks like it's on the upper outer part of her breast, and that implant has migrated below the breast fold, which has been completely violated. That's a huge problem. That's gonna have to be reconstructed. It's stretched out the skin over her sternal bone, and then it's also taken the upper abdominal skin and stretched into there. So the implant is completely malpositioned, one of the worst I've ever seen, but it can be fixed.
Michael has not seen my breasts since they were done. I really don't want him to touch them. I did it to enhance us. And did it enhance our relationship? No, it didn't.
When I see patients in my practice, this is something that I talk about in the consultation room. You have to do it for you and only for you, because if you don't, that's when bad things start to happen.
I don't feel pretty. I don't feel sexy. It's affected my life in the past 4 years. It's just been kind of an ego bust. He broke up with me shortly after, and he started seeing someone else who had big boobs.
Nice to see you come to bed not all wrapped up like a mummy.
I think sexually...
Record scratch reverse. What? Like, dude, come on. The insensitivity of certain guys and the selfishness blows me away. She seems like such an amazing woman, and to have someone treat her that way, nope.
I can't wrap my brain around how a breast surgery could result, wait for it, in this.
I totally agree.
What happened to her breast? That's not real.
Insane.
I've seen hundreds of breast deformities, but a deformity like this with 3 breasts? No way. First time. Can you please send Sandra?
Worst I've seen, and I've seen
Sandra.
something bad.
Hi.
So, Sandra,
Yes.
I've got to tell you, we have this expression in breast revisional surgery called malposition. Means that the breast implant is not in the right place. You have the most dramatic example of malposition I've ever seen in my entire career.
I referred to myself as the three-boobed lady. I feel like a circus freak.
So, you went to a plastic surgeon, I assume?
Yes, I did. I told him I don't want to go big. I just want a normal C. Small C would have been perfect.
It's a great time to pause and let's talk about cup size. I will never promise you a cup size because all bras are different. For me, and this is just my personal opinion, it's a horrible way to talk about what you want when you go to a consultation. If I could give any of you guys advice when you go in for a consultation and you're gonna be talking about size, don't focus on implant size, don't focus on cup size. I use vision board photos where I send them to a website and we look at before and afters, and in the before I want them to try to pick someone that kind of looks like them, and then in the afters they pick 2 to 3 to 4 to 5 that if they could be that size and that shape, and then we have a conversation about which ones of those are realistic expectations and which ones aren't, and I then go to the operating room and I have different silicone sizers that match the real implant, and we just try different ones until we get the right size. But stay away from thinking about a cup size because you will ultimately be disappointed because the bras are so different post-surgical.
I woke up from surgery. My right breast was way up here.
Immediately.
Immediately.
Did he ever tell you what happened in surgery?
He admitted to me that he says, I must have done something wrong.
Okay, did you let him
think?
fix it?
Yes, I did.
So now we're about to find out how you got to this. This is your last operation, right?
Yes.
All right, tell us this story.
He just went in to fix it. As I was recovering, it was in the middle of my chest. I never went back to him again.
How did you manage that emotionally?
I just hid it from myself and from him. And I mean, I'm never without my bra. He never sees me naked, ever.
No?
So
I'm
sad.
so
Some
embarrassed.
pictures I had to take.
We have recently, and that was the first time you've ever seen
Yeah.
them? You never knew she had this brewing underneath.
Yeah,
I didn't know it was that bad. I mean, I walked into her house one day and she was laying in the bathroom, had candles around, but she had a bra on. I was like, oh, my God, you know, yeah.
So, okay, I don't say this to scare you, I'm just telling you the truth. This is an extraordinarily hard operation and very, very risky.
That scares me.
So what these cases boil down to is a surgical plan. Yes, it's a very difficult case, but very clear and concise. Here's what I would do. There's a couple of things going into this operation that I know right away that I need to fix. The position of the implant is it behind the muscle? Is it in front of the muscle? And that is that the boundaries of that right breast have been completely violated. I don't know why it's crossing the midline. My hunch is they took down the muscle accidentally, and I don't know why it's going lower, and my hunch is that they have violated the fold. All of those things are fixable with resuturing those anatomical landmarks back in place. And personally, I would use a piece of mesh internally to support that repair. That's what I would do.
Boy, just let me look at that for a second. Wow, look at that. So do me a favor, put your hands on your
Just let me
hips
look at that
and
for a
push.
second.
Look at that deformity.
Freeze there. Here's what I want you to see. What's happening here is the implant has dropped down this way. And if you can see that outline, her entire breast is up and over to the side. So her whole breast has been pushed off to the side because the implant has gone down. What we need to do is to reestablish the boundaries so the breast then recenters over the implant to reestablish the breastbone border and then the breast crease border. That's what needs to be done here. We do these all the time. It is a tough case, but totally fixable. They really messed her up.
Holy sh**. So the two key variables we need to focus on are how much natural breast tissue do you have, and two, how much has the skin been stretched in the areas outside of your breast tissue? And you've got some natural breast tissue. That's a very positive thing. The more natural breast tissue you have, the more blood supply you have, and the more padding you have over the implant. So when you replace the implant, this is sort of where your breast should be. This is breast skin, this is abdominal skin.
Yep.
And this is sternal skin, the breastbone skin. This skin has lost its own internal collagen and elastin.
All that skin that's been stretched out, when he reestablishes the border, that skin is still gonna look like a little bubble because it's kind of not stuck back down to the chest. So that's either gonna need to be sutured down, or sometimes I've put a surgical drain that's gonna be in the pocket into that area to help suck that skin down. So let's see how Dr. Dubrow handles that one in the OR.
Sandra's surgeon not only over dissected her pocket towards the center, but downwards onto her abdomen. That stretched out the skin,
Horrible.
and I really have my work cut out for me.
That's horrible.
I think best option is take the implant out, close the pocket off, put a new implant in that fits, and find a way to tighten the skin somehow to rearrange the tissue so that you have 2 mounds that are symmetrical.
Please.
And the skin that shows a good envelope and everything is healthy and normal.
So I love everything he said, except it seems like he's like, we'll just kind of figure the skin out. And in him manipulating that breast back into its normal position, it doesn't look like she's gonna need a breast lift. I think really the issue is gonna be reestablishing that pocket with some suturing techniques, getting a new implant in there, potentially bigger or smaller, depending on what her goals are. And I personally, he didn't mention this, but I would be using a piece of mesh. This is like suture material, and it'll disappear over like 18 to 24 months. If you have a breast implant and you want to support the implant like an internal bra, I think that she needs it placed in this manner so that she can support the full length of that entire repair that he's gonna have to do to keep the implant from them sliding down to where it was before. But this mesh is dissolvable, and what happens is this disappears and you're left behind with a really nice solid scar matrix that just basically mimics the mesh and holds everything in place.
Let's kick its ass.
Let's kick its ass.
More and more, it's sounding like this is possible. That
Totally
it's
possible.
Fixable.
Girl,
So
I would fix you up.
I'm hopeful.
So you have what I had called the mother of all malpositions. Ideally, what you want is obviously the implant centered behind the areola.
I am so ready to be not the third boob lady anymore.
So we want it like this, but instead...
It feels like something crawling inside of me.
Yeah.
So weird.
Crazy. Let's do it, boss.
For Sandra's surgery, I will start by making an incision under her right areola and remove her old implant. I will then recreate the pocket by closing down the areas that were over-dissected, insert a new implant, and then tighten the skin on the lower portion of the breast. Next, I will open up the left side, remove her old implant and the scar tissue, and then tighten the entire breast envelope to obtain symmetry.
It sounds like she's gonna need a breast lift on the left side. He doesn't think that she's gonna need it on the right side. The unknown here is, where is that implant? Under the muscle, above the muscle, and what is the status of the muscle, and will it need to be repaired?
The first step is to open up the right breast and see what kind of tissue there is to make new barriers out of. Oh, wow, that's so interesting. So originally she had breast implants put in, but she said they were really high. She thought he put them wrong, but she just had capsular contracture. The same doctor treating the capsular contracture took too much scar tissue out and opened up the pocket too far, and then it just was in the abdomen.
So, capsular contracture, what is that? Whenever we put a foreign body into a person, you form what's called an amniotic sac around it. It's like a small sac around the implant. It's your own body's tissue. Sometimes that can become diseased over years and years and years. If it doesn't happen within the first year, this contracture, usually 90% or greater occur within the first year. Now, implants that are in for a really, really long time, that capsule can start to squeeze around the implant, and that's called a contracture. And the cure for that is to go in and take out that whole capsule. What I don't understand is he said that he took out too much. It's not that he took out too much. He took the capsule out and then just ignored normal anatomy and blew through the muscle attachments in the inframammary fold, which when we take out a capsule, that shouldn't happen. Now, if you weaken those structures when you take the capsule out, I always place sutures internally at that time to support it so that this doesn't happen.
Sandra's original surgeon attempted to fix capsular contracture by creating an entirely new pocket outside of the original pocket. I can close down the extra pocket and then put the implant in right behind the breast. You know what they say, you can't go back. We're gonna test that theory.
Instead of taking out the old capsule, he released the capsule from the breast and then went and actually put the implant into a new pocket. So it's called a neo-subpectoral pocket. So we elevate or get rid of the old pocket where the capsule is. Instead of taking it all out, we then put the implant into a new space. And that's something that's acceptable and done quite often and can work really well.
Uh-oh. Since
See
this
that?
is not stuck down, I could tent this if I go near there.
So exactly what I said I thought was gonna be a problem, and I'm watching this blind. That skin is a little puffy where it was elevated off of the breastbone and the upper abdomen. I'm interested to see how he handles it, if he puts a drain in there or sutures it. I would do both. I would suture it and I would put a drain in.
The stretched out lax skin overlying the breastbone, which is normally supposed to be very tight, is actually causing an abnormal breast shape and breast contour.
You can fix it, man. Come on. You got this.
So he
Dubrow.
put the implant completely under both the pectoralis major and the pectoralis minor. Kind of a no-no.
Okay, that is a huge problem. We're gonna have to show some anatomy for this.
Uh-oh. Although it might just stick down just the way an old capsule closes off on itself. Put a drain in it.
So it sucks down.
Yeah, I could get I could put a drain in that. Well, I'm gonna have to come up with something creative that may involve putting a suction device to try to get the skin to stick directly down to the chest wall and make the overall breast contour better. Will it work? Here's hoping.
It will.
Let's open up this left side and see if it's something strange like the other side. So he put the implant completely under both the pectoralis major and the pectoralis minor.
What? When we do breast augmentations, the most common thing to do is to elevate the pectoralis major muscle off of the pec minor, which sits below the pec major against the rib cage in the chest wall. We then put the implant into that space. What this guy did, which is just a humongous F job, in my opinion, was he elevated the pec minor and the pec major. So he took the pec minor all the way off the rib cage. And even if you started to do that, you should recognize, oh crap, I'm on the chest wall. I see ribs in this area where the pec minor is. I shouldn't be under that. Let me redirect and go above that. That's okay, that happens. Sometimes we get in the wrong plane for maybe a split second. We recognize it, we back up and we get into the right plane. But elevating the pec minor muscle is a problem because there are nerves that travel through the pec major and the pec minor, and you can really sever nerves and do some pretty harmful stuff here. So let's see what happens.
It's going to require a lot of recovery and maybe a little bit of luck. If this works, she should be extraordinarily happy because I've never seen a malposition this bad, nor do I ever want to see it again. Exceeded my expectations completely. Okay,
good.
put her down, let's close. Yes! Yes!
I have to address this. I see Dr. Dubrow do that all the time. And while most of us are celebrating when we have a good result on the table, none of us do a cheer in surgery, but I will tell you, it ain't over till it's over. I always tell my patients, I will take my thanks when you're 6 months out and you're still looking good and things are still healing and you look great and you're happy, because things can change drastically between that moment in the OR and the first month or two of recovery.
Would you like to hear what I found?
Yes. I have a big smile on my face because I don't feel like somebody ran me over. And you know what? To me, that's a great sign.
As you know, this skin's supposed to be very tightly adherent to the breastbone, but it was disrupted completely. So I put a drain in with suction, sticking this one down, and it will theoretically, hopefully it should, heal down. This one is fixed in a good spot. This one is lifted, and they should end up very close. But what I'm really concerned about is what she refers to as that circus act of that third breast. And I'm just hoping the circus has left town and has taken the clowns with them.
You know, we are chasing perfection to get perfect symmetry. Not possible in a situation like this. The goal is to get them as close as possible, to make them look as symmetric as possible, but we are never, ever, ever able to get these completely perfect.
Baby, I don't have boob in the middle of my chest anymore.
Looks great.
Wow.
Well, y'all don't think so, but she
Not
looks
bad,
great.
huh?
I don't have a boob in the middle of my chest anymore.
Why does he not
I'm
look happy
normal.
for her?
I am no longer the three-boobed lady. How's that?
So good.
I'm excited.
We have a good result brewing. Let's brew it all the way to the end, all right?
I just want to get Sandy healed, but it's hard to say if it's going to change our future. We'll just see what happens.
Dude, kick him to the curb. Bye-bye.
I went from teeny tiny little peas into a nightmare, a breast to the middle of my chest. I was not normal, and I lived with that for 5 years. Now, they're both where they're supposed to be. It feels good to have 2 boobs instead of 3. I feel like a beautiful woman.
Yeah, it will be good to see Mom.
Yeah. Even after that whole breakup, it's almost like it was for the better.
They
I think
broke
so, too.
up.
After surgery, I
Good girl.
literally got a lot off my chest. Unfortunately, things with Michael and I didn't work out. We both went our separate ways.
Fortunately.
I knew there were problems, and it took 3 boobs on my chest to realize that I don't need to be sexy for anybody but myself.
Yes. Good for you.
My mom looks amazing. You can really see the glow coming from the inside now.
All right, let's see the
Before my
and
surgery, I
afters.
had 3 boobs, a deformed breast on the right, one in the middle, and a hard rock on my left. I look like a circus freak, but now, thanks to Dr. Dubrow, I have 2 perfectly symmetrical breasts. I feel sexy and secure in my skin, and I don't need a man to validate that. I rock it.
Do rock it, girl. So you can see from her before and afters what a beautiful job Dr. Dubrow has done. Really happy for her. She got out of a bad relationship. She got her 3-boobed chest fixed, and I think she should move on to have a very fruitful, healthy life, hopefully. They're not perfect. They're not perfectly symmetric, but they're markedly improved from where they were. And just remember, we're always striving for perfection. We're chasing it, but we don't always get there. Well, that wraps up another episode of Botched. Thank you so much for watching. Remember, guys, share my videos if you like them. Get your friends to follow me. Don't be afraid. Leave some comments and let me know what other kinds of videos you want to see. The moral of the story for this episode is if you're going to have plastic surgery, surgery is always your last resort, but if you're going to do it for you and no one else. For now, Dr. Ricky, out.